Hi, everyone. This is Nurse Anna from nursestudy.net. Now we are starting our cardiovascular series that is tested on the NCLEX NGN. The first we have here is rheumatoid heart disease. This is the first, and I believe, 11 sets of cardiovascular tests that I will be putting out there. And then at the end, I will be combining them. So I think there'll be like 2 or 3 videos with 100 questions that combine them. And remember that if you need information on pathophysiology, nursing diagnosis, or nursing care plans, you can visit us at nursestudy.net. It's a free website, and you just type in on the search box what you're looking for, and it will come up. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 16-year-old patient with a history of rheumatic fever presents with fatigue, dyspnea on exertion, and a newly detected heart murmur. The nurse anticipates which diagnostic test will most likely be ordered by the healthcare provider to evaluate the suspected rheumatic heart disease. A. Chest X-ray. B. Echocardiogram. C. Electrocardiogram ECG. D. Cardiac catheterization. Answer, B. Echocardiogram. Rationale: an echocardiogram is the most useful non-invasive diagnostic test for evaluating the structure and function of heart valves, which are often affected by rheumatic heart disease. It provides detailed images that can reveal valve damage, stenosis, or regurgitation. While the other tests can provide valuable information, the echocardiogram is the gold standard for assessing valve abnormalities in rheumatic heart disease. Question 2. A 30-year-old patient with rheumatic heart disease is admitted with worsening shortness of breath and orthopnea. The nurse recognizes that these symptoms may indicate which complication. A. Pulmonary embolism. B. Heart failure. C. Myocardial infarction. D. Pericarditis. Answer, B. Heart failure. Rationale: worsening shortness of breath and orthopnea in a patient with rheumatic heart disease are indicative of heart failure, a common complication due to the progressive damage to heart valves. This damage can lead to decreased cardiac output and pulmonary congestion, manifesting as the described symptoms. Question 3. During a follow-up visit, a patient with a history of rheumatic heart disease reports persistent fatigue and occasional dizziness. The nurse understands that these symptoms are most likely related to which underlying pathophysiological process. A. Decreased cerebral perfusion due to aortic stenosis. B. Hyperthyroidism. C. Anxiety and depression. D. Gastroesophageal reflux disease, GERD. Answer, A. Decreased cerebral perfusion due to aortic stenosis. Rationale: persistent fatigue and dizziness in a patient with rheumatic heart disease may be due to aortic stenosis, where the narrowed aortic valve restricts blood flow, leading to reduced cerebral perfusion. This is a serious consequence of rheumatic fever-induced valve damage. Question 4. A nurse is educating a patient with rheumatic heart disease about the importance of antibiotic prophylaxis before certain procedures. Which procedure is most likely to require antibiotic prophylaxis to prevent bacterial endocarditis? A. Routine dental cleaning. B. Abdominal ultrasound. C. Chest X-ray. D. Blood transfusion. Answer, A. Routine dental cleaning. Rationale: patients with rheumatic heart disease are at increased risk for bacterial endocarditis due to damaged heart valves. Routine dental procedures, such as cleanings, can introduce bacteria into the bloodstream, making antibiotic prophylaxis necessary to prevent the serious infection. Question 5. A patient with rheumatic heart disease is scheduled for valve replacement surgery. The nurse prepares the patient by explaining the importance of which preoperative intervention. A. Administering a diuretic. B. Ensuring that the patient is free from infection. C. Withholding all medications. D. Restricting fluids. Answer B. Ensuring that the patient is free from infection. Rationale: prior to valve replacement surgery, it is crucial to ensure the patient is free from infection to prevent postoperative complications such as prosthetic valve endocarditis. This involves assessing for signs of infection and administering prophylactic antibiotics as necessary. Question 6. The nurse is monitoring a patient with rheumatic heart disease who is receiving digoxin. Which assessment finding would require immediate intervention? A. Heart rate of 90 beats per minute. B. Serum potassium level of 3.5 milliequivalent per liter. C. Digoxin level of 2.5 nanograms per milliliter. D. Blood pressure of 120/80. Answer C. Digoxin level of 2.5 nanograms per milliliter. Rationale: a digoxin level of 2.5 nanograms per milliliter is above the therapeutic range, 0.5 to 2.0 nanograms per milliliter, and indicates digoxin toxicity, which can lead to life-threatening arrhythmias, especially in a patient with heart disease. Immediate intervention is required to prevent complications. Question 7. A patient with rheumatic heart disease is experiencing severe mitral valve stenosis. The nurse knows that this condition can lead to which of the following complications? A. Atrial fibrillation. B. Ventricular tachycardia. C. Pulmonary embolism. D. Stroke. Answer A. Atrial fibrillation. Rationale: severe mitral valve stenosis increases left atrial pressure, leading to atrial enlargement and predisposition to atrial fibrillation. This arrhythmia can cause blood stasis in the atria, increasing the risk of thrombus formation and subsequent embolic events. Question 8. A nurse is caring for a patient with rheumatic heart disease who has developed a fever, chills, and a new heart murmur. What is the nurse's priority action? A. Administer acetaminophen. B. Draw blood cultures. C. Start broad-spectrum antibiotics. D. Notify the healthcare provider. Answer B. Draw blood cultures. Rationale: the priority action is to draw blood cultures before administering antibiotics to identify the causative organism in suspected infective endocarditis. This condition is a serious complication in patients with rheumatic heart disease and requires prompt diagnosis and treatment. Question 9. A patient with rheumatic heart disease presents with signs of right-sided heart failure. The nurse would expect which clinical findings? A. Pulmonary edema, crackles, and orthopnea. B. Ascites, peripheral edema, and jugular vein distension. C. Hypertension, headache, and visual disturbances. D. Chest pain, palpitations, and diaphoresis. Answer B. Ascites, peripheral edema, and jugular vein distension. Rationale: right-sided heart failure, which can occur in rheumatic heart disease, typically presents with systemic congestion signs such as ascites, peripheral edema, and jugular vein distension, due to impaired right ventricular function. Question 10. A nurse is planning care for a patient with rheumatic heart disease who is at risk for developing infective endocarditis. Which nursing intervention is most appropriate to include in the care plan? A. Encouraging high fluid intake. B. Maintaining strict oral hygiene. C. Administering anticoagulants. D. Educating about low-sodium diet. Answer B. Maintaining strict oral hygiene. Rationale: strict oral hygiene is essential for preventing infective endocarditis in patients with rheumatic heart disease, because poor dental hygiene can lead to bacteremia, which can colonize damaged heart valves and cause infection. Question 11. A patient with a history of rheumatic heart disease and mechanical valve replacement is prescribed warfarin. Which patient teaching is crucial for the nurse to emphasize? A. Avoid foods high in potassium. B. Regularly monitor INR levels. C. Take aspirin daily. D. Increase intake of green leafy vegetables. Answer B. Regularly monitor INR levels. Rationale: patients on warfarin therapy require regular monitoring of their INR to ensure it remains within the therapeutic range, reducing the risk of bleeding or thromboembolic events. This is especially important in patients with mechanical valves, which necessitate anticoagulation. Question 12. During a home visit, a nurse assesses a patient with rheumatic heart disease who reports increased fatigue and palpitations. What should the nurse suspect is occurring? A. Onset of ventricular fibrillation. B. Development of mitral regurgitation. C. Progression of aortic stenosis. D. Exacerbation of heart failure. Answer B. Development of mitral regurgitation. Rationale: fatigue and palpitations in a patient with rheumatic heart disease may indicate the development of mitral regurgitation, where the mitral valve fails to close properly, leading to backflow of blood into the left atrium and decreased cardiac efficiency. Question 13. A nurse is caring for a patient with rheumatic heart disease who suddenly develops acute chest pain, dyspnea, and diaphoresis. What is the nurse's priority intervention? A. Administer nitroglycerin. B. Initiate oxygen therapy. C. Call for immediate assistance. D. Obtain an ECG. Answer C. Call for immediate assistance. Rationale: the sudden onset of acute chest pain, dyspnea, and diaphoresis suggests a potentially life-threatening condition such as myocardial infarction or acute valve failure. The nurse's priority is to call for immediate assistance while preparing to initiate emergency interventions. Question 14. The nurse is reviewing discharge instructions with a patient who has rheumatic heart disease and a prosthetic valve. Which patient statement indicates a need for further teaching? A. I will need to take antibiotics before dental procedures. B. I can stop taking my warfarin once I feel better. C. I should avoid foods high in vitamin K. D. I need to monitor my blood pressure regularly. Answer B. I can stop taking my warfarin once I feel better. Rationale: this statement indicates a misunderstanding, as patients with prosthetic valves typically require lifelong anticoagulation therapy with warfarin to prevent thromboembolic events. Stopping warfarin abruptly could be dangerous. Question 15. A patient with a history of rheumatic heart disease is admitted with a suspected pulmonary embolism. The nurse anticipates which diagnostic test will be ordered first. A. D-dimer test. B. Chest X-ray. C. CT pulmonary angiography. D. Ventilation perfusion, VQ, scan. Answer C. CT pulmonary angiography. Rationale: CT pulmonary angiography is the gold standard for diagnosing pulmonary embolism because it provides detailed images of the pulmonary arteries. While the D-dimer test is useful for ruling out PE, a CT pulmonary angiography is necessary for definitive diagnosis. Question 16. A nurse is educating a patient with rheumatic heart disease on the importance of medication adherence. Which medication is most likely to be prescribed to prevent recurrent rheumatic fever? A. ACE inhibitors. B. Beta blockers. C. Long-term penicillin. D. Diuretics. Answer C. Long-term penicillin. Rationale: Long-term penicillin or another suitable antibiotic is typically prescribed to prevent recurrent rheumatic fever in patients with a history of rheumatic heart disease. This prophylactic treatment helps prevent further damage to the heart valves. Question 17. A patient with rheumatic heart disease is scheduled for a colonoscopy. The nurse recognizes the need to clarify which aspect of the patient's pre-procedure care. A. Antibiotic prophylaxis. B. Bowel preparation regimen. C. NPO status. D. Post-procedure monitoring. Answer: A. Antibiotic prophylaxis. Rationale: for patients with rheumatic heart disease undergoing invasive procedures such as a colonoscopy, antibiotic prophylaxis may be necessary to prevent infective endocarditis. The nurse should clarify the need for this with the healthcare provider. Question 18. The nurse is assessing a patient with rheumatic heart disease who is at risk for developing heart failure. Which early symptom should the nurse monitor for? A. Peripheral edema. B. Nocturnal dyspnea. C. Orthostatic hypotension. D. Weight gain. Answer: B. Nocturnal dyspnea. Rationale: nocturnal dyspnea, or difficulty breathing at night, is an early sign of left-sided heart failure, which can occur due to the progressive damage from rheumatic heart disease. This symptom results from pulmonary congestion that worsens when lying down. Question 19. A patient with rheumatic heart disease is being discharged on a regimen of daily aspirin. The nurse should educate the patient about which potential complication. A. Increased risk of stroke. B. Gastrointestinal bleeding. C. Hypotension. D. Hyperkalemia. Answer: B. Gastrointestinal bleeding. Rationale: aspirin, an antiplatelet agent, increases the risk of gastrointestinal bleeding due to its effect on the stomach lining and its inhibition of platelet aggregation. Patients should be educated on the signs of GI bleeding and the importance of taking the medication as prescribed. Question 20. A nurse is caring for a patient with rheumatic heart disease who is exhibiting signs of infective endocarditis. Which laboratory test result would the nurse expect to find? A. Elevated troponin levels. B. Positive blood cultures. C. Low white blood cell count. D. Decreased erythrocyte sedimentation rate, ESR. Answer: B. Positive blood cultures. Rationale: positive blood cultures are a key diagnostic indicator of infective endocarditis, a serious complication of rheumatic heart disease. The presence of bacteria in the blood confirms the diagnosis and guides antibiotic therapy. Question 21. A patient with a history of rheumatic heart disease presents with complaints of fatigue and decreased exercise tolerance. The nurse suspects worsening mitral valve stenosis. What is the most appropriate nursing action? A. Encourage increased physical activity. B. Arrange for an immediate stress test. C. Notify the healthcare provider about the symptoms. D. Educate the patient about dietary modifications. Answer: C. Notify the healthcare provider about the symptoms. Rationale: fatigue and decreased exercise tolerance are classic symptoms of worsening mitral valve stenosis. The nurse's priority is to notify the healthcare provider so that appropriate diagnostic tests, such as an echocardiogram, can be ordered to assess the severity of the valve stenosis and guide treatment. Question 22. The nurse is providing discharge teaching to a patient with rheumatic heart disease and a mechanical mitral valve replacement. Which statement by the patient indicates a correct understanding of the need for anticoagulation therapy? A. I can stop my warfarin when I feel my heart is stable. B. I will need regular blood tests to monitor my INR. C. I can take herbal supplements freely with warfarin. D. I should avoid all physical activity while on warfarin. Answer: B. I will need regular blood tests to monitor my INR. Rationale: patients with mechanical valve replacements require lifelong anticoagulation therapy, typically with warfarin, to prevent thromboembolic events. Regular monitoring of the INR is essential to ensure the blood is adequately anticoagulated and to adjust the dosage as needed. Question 23. A patient with rheumatic heart disease is hospitalized for a planned mitral valve repair. The nurse reviews the preoperative orders and notes that the patient is to receive prophylactic antibiotics. What is the primary rationale for this order? A. To prevent postoperative wound infection. B. To prevent bacterial endocarditis. C. To treat an existing urinary tract infection. D. To reduce the risk of pneumonia. Answer: B. To prevent bacterial endocarditis. Rationale: patients with rheumatic heart disease undergoing invasive procedures, such as valve repair, are at increased risk of developing bacterial endocarditis. Prophylactic antibiotics are administered to prevent this potentially life-threatening infection. Question 24. During a routine examination, a nurse assesses a patient with a history of rheumatic heart disease and notes a diastolic murmur. The patient denies any symptoms. What is the most appropriate nursing intervention? A. Schedule the patient for a cardiac stress test. B. Monitor for symptoms and educate the patient on when to seek medical attention. C. Immediately notify the healthcare provider. D. Increase the frequency of follow-up visits. Answer: B. Monitor for symptoms and educate the patient on when to seek medical attention. Rationale: a diastolic murmur in a patient with rheumatic heart disease suggests valve involvement, possibly mitral or aortic valve stenosis. If the patient is asymptomatic, the nurse should educate the patient on potential symptoms of worsening valve disease and ensure regular monitoring, while the healthcare provider should be informed during the next routine visit. Question 25. A nurse is educating a patient with rheumatic heart disease on lifestyle modifications to manage symptoms and prevent complications. Which recommendation is most appropriate? A. Avoid all physical activity to reduce cardiac workload. B. Follow a high-sodium diet to maintain blood pressure. C. Engage in moderate physical activity as tolerated. D. Increase fluid intake to prevent dehydration. Answer: C. Engage in moderate physical activity as tolerated. Rationale: patients with rheumatic heart disease should be encouraged to engage in moderate physical activity as tolerated to maintain cardiovascular health and prevent deconditioning. However, activities should be tailored to the patient's tolerance and energy levels, avoiding excessive strain on the heart.
Hi everyone, this is Nurse Anna from NurseStudy.net. We are continuing our cardiovascular disorder series. This is going to be 25 questions for pulmonary embolisms, and then we will be moving on to another one in a couple days. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 55-year-old patient with a history of deep vein thrombosis, DVT, is admitted with sudden onset of shortness of breath, chest pain, and tachycardia. The nurse suspects a pulmonary embolism, PE. What is the nurse's priority action? A. Administer oxygen at 2 liters per minute via nasal cannula. B. Prepare the patient for a spiral CT scan. C. Notify the healthcare provider immediately. D. Initiate continuous cardiac monitoring. Answer: C. Notify the healthcare provider immediately. Rationale: the nurse's priority action is to notify the healthcare provider because a PE is a medical emergency that requires immediate intervention. Oxygen can be administered and diagnostic tests prepared for after the healthcare provider is informed and orders are received. Question 2. A patient on anticoagulant therapy for a confirmed pulmonary embolism reports new onset hemoptysis. What is the most appropriate nursing action? A. Increase the anticoagulant dosage as prescribed. B. Reassure the patient that this is a normal side effect. C. Hold the next dose of anticoagulant and notify the healthcare provider. D. Place the patient in a Trendelenburg position. Answer: C. Hold the next dose of anticoagulant and notify the healthcare provider. Rationale: hemoptysis can indicate a potential complication such as bleeding due to anticoagulant therapy. The nurse should hold the medication and notify the healthcare provider to reassess the patient's condition and treatment plan. Question 3. A patient with a suspected pulmonary embolism is receiving continuous heparin infusion. The nurse notices that the patient has a significantly increased APTT. What is the appropriate action? A. Increase the rate of the heparin infusion. B. Administer protamine sulfate as prescribed. C. Stop the heparin infusion and restart at a lower rate. D. Continue monitoring without making any changes. Answer: B. Administer protamine sulfate as prescribed. Rationale: protamine sulfate is the antidote for heparin overdose. An increased APTT indicates excessive anticoagulation, which can lead to bleeding complications. The nurse should administer the antidote as ordered. Question 4. A nurse is caring for a patient diagnosed with a massive pulmonary embolism. Which of the following interventions should the nurse anticipate first? A. Initiate intravenous thrombolytic therapy. B. Prepare the patient for emergency embolectomy. C. Begin IV fluids to maintain blood pressure. D. Place the patient in a high Fowler's position. Answer: A. Initiate intravenous thrombolytic therapy. Rationale: thrombolytic therapy is often the first line of treatment for a massive PE to rapidly dissolve the clot and restore pulmonary circulation. Other interventions may follow based on the patient's response. Question 5. A patient with a recent diagnosis of pulmonary embolism is prescribed warfarin. Which laboratory test should the nurse monitor to determine the effectiveness of the treatment? A. Partial thromboplastin time, PTT. B. International Normalized Ratio, INR. C. D-dimer levels. D. Complete blood count, CBC. Answer: B. International Normalized Ratio, INR. Rationale: INR is used to monitor the therapeutic effects of warfarin therapy. The target INR range for a patient on warfarin is typically 2.0 to 3.0, depending on the clinical scenario. Question 6. A nurse is reviewing discharge instructions with a patient who has been treated for a pulmonary embolism. Which statement indicates a need for further teaching? A. I will take my warfarin at the same time every day. B. I can stop taking my medication once I feel better. C. I will schedule regular blood tests to check my INR. D. I should avoid foods high in vitamin K. Answer: B. I can stop taking my medication once I feel better. Rationale: patients should not stop taking anticoagulants without consulting their healthcare provider, even if they feel better. This misunderstanding could lead to a recurrence of thromboembolic events. Question 7. A patient develops sudden dyspnea and chest pain while receiving IV heparin for a confirmed pulmonary embolism. What is the nurse's immediate action? A. Increase the oxygen flow rate. B. Elevate the head of the bed. C. Stop the heparin infusion and assess for signs of hemorrhage. D. Call a rapid response team. Answer: D. Call a rapid response team. Rationale: The sudden onset of dyspnea and chest pain in a patient receiving heparin therapy could indicate a worsening of the PE or a complication such as a hemorrhage. Immediate assessment and intervention by a rapid response team are necessary. Question 8. A patient receiving thrombolytic therapy for a pulmonary embolism is at risk for bleeding. Which of the following assessments should the nurse prioritize? A. Monitoring for signs of internal bleeding, such as decreased hemoglobin and hematocrit. B. Assessing for peripheral edema. C. Monitoring for hyperkalemia. D. Assessing for hypocalcemia. Answer A. Monitoring for signs of internal bleeding, such as decreased hemoglobin and hematocrit. Rationale: thrombolytic therapy increases the risk of bleeding. Hemoglobin and hematocrit levels should be monitored to detect internal bleeding, which can be life-threatening if not promptly addressed. Question 9. During the administration of enoxaparin to a patient with pulmonary embolism, the nurse notes bruising at the injection site. What is the best nursing intervention? A. Apply pressure to the injection site for 1 to 2 minutes. B. Rotate injection sites and avoid areas of bruising. C. Hold the next dose of enoxaparin. D. Administer the next dose intravenously instead of subcutaneously. Answer B. Rotate injection sites and avoid areas of bruising. Rationale: enoxaparin can cause localized bruising due to its anticoagulant effects. Rotating sites helps minimize this effect. Holding the dose is not necessary unless there is significant or unexplained bruising. Question 10. A nurse is preparing to administer a prescribed dose of alteplase to a patient with a confirmed massive pulmonary embolism. Which of the following is the most critical assessment prior to administration? A. Current blood pressure and heart rate. B. History of recent surgery or trauma. C. Recent intake of anticoagulant medication. D. Presence of deep vein thrombosis. Answer B. History of recent surgery or trauma. Rationale: thrombolytic agents like alteplase are contraindicated in patients who have had recent surgery or trauma due to the high risk of severe bleeding. This history must be evaluated before administration. Question 11. A patient on warfarin therapy for pulmonary embolism reports frequent headaches and occasional nosebleeds. What should the nurse do first? A. Advise the patient to take aspirin for the headaches. B. Instruct the patient to skip the next dose of warfarin. C. Check the patient's INR and contact the healthcare provider. D. Encourage the patient to drink more fluids. Answer C. Check the patient's INR and contact the healthcare provider. Rationale: frequent headaches and nosebleeds may indicate over-anticoagulation. The nurse should check the INR to assess the level of anticoagulation and notify the healthcare provider for further instructions. Question 12. A patient with a history of atrial fibrillation is admitted with a suspected pulmonary embolism. The nurse anticipates the healthcare provider will order which of the following medications first? A. Warfarin. B. Heparin. C. Aspirin. D. Enoxaparin. Answer B. Heparin. Rationale: heparin is typically the first-line anticoagulant used for the initial treatment of pulmonary embolism due to its rapid onset of action. Warfarin is usually initiated later for long-term anticoagulation. Question 13. A nurse is teaching a patient who has been discharged on rivaroxaban for a pulmonary embolism. Which of the following statements should be included in the teaching? A. You will need to have your INR checked regularly. B. Avoid taking over-the-counter NSAIDs. C. You can take this medication at any time of the day. D. Increase your intake of green leafy vegetables. Answer B. Avoid taking over-the-counter NSAIDs. Rationale: NSAIDs can increase the risk of bleeding when taken with anticoagulants like rivaroxaban. Patients should avoid these medications unless directed otherwise by their healthcare provider. Question 14. A patient receiving IV heparin for a pulmonary embolism suddenly becomes hypotensive and tachycardic. What should be the nurse's immediate action? A. Increase the rate of the heparin infusion. B. Administer IV fluids as ordered. C. Assess for signs of bleeding and stop the heparin infusion. D. Place the patient in a supine position. Answer: C. Assess for signs of bleeding and stop the heparin infusion. Rationale: hypotension and tachycardia could indicate internal bleeding, especially in a patient receiving heparin. The nurse should stop the heparin infusion immediately and assess for signs of bleeding. Question 15. A patient with a pulmonary embolism is being considered for placement of an inferior vena cava (IVC) filter. The nurse understands that the primary purpose of this device is to A. Dissolve existing blood clots. B. Prevent future emboli from reaching the lungs. C. Improve cardiac output. D. Facilitate the administration of thrombolytics. Answer: B. Prevent future emboli from reaching the lungs. Rationale: the IVC filter is designed to trap emboli before they reach the pulmonary circulation, thus preventing recurrent pulmonary embolism. It does not dissolve clots or directly improve cardiac output. Question 16. A nurse is providing discharge instructions to a patient who was treated for a pulmonary embolism. Which lifestyle modification should the nurse emphasize to prevent recurrence? A. Limit your fluid intake to avoid blood clots. B. Incorporate regular physical activity, like walking, into your routine. C. You should avoid all physical activity to prevent strain. D. Increase your intake of vitamin K-rich foods. Answer: B. Incorporate regular physical activity, like walking, into your routine. Rationale: regular physical activity, such as walking, helps improve circulation and reduce the risk of clot formation. Fluid restriction and increased vitamin K intake are not recommended in this context. Question 17. A nurse is assessing a patient with a suspected pulmonary embolism. Which of the following is the most indicative clinical sign that the patient may have a PE? A. Bilateral leg swelling. B. Hemoptysis and sudden, sharp chest pain. C. Persistent cough with sputum production. D. Wheezing and rhonchi upon auscultation. Answer: B. Hemoptysis and sudden, sharp chest pain. Rationale: hemoptysis and sudden, sharp chest pain are classic signs of a pulmonary embolism. While other symptoms like cough or wheezing may occur, they are not as strongly indicative of a PE. Question 18. A patient with a history of pulmonary embolism is on long-term anticoagulation therapy. The nurse should instruct the patient to avoid which of the following to minimize the risk of bleeding? A. Green leafy vegetables. B. Over-the-counter herbal supplements like ginkgo biloba. C. Engaging in light aerobic exercise. D. Drinking more than 2 liters of water per day. Answer: B. Over-the-counter herbal supplements like ginkgo biloba. Rationale: herbal supplements like ginkgo biloba can increase the risk of bleeding, especially in patients on anticoagulation therapy. Patients should consult their healthcare provider before taking any supplements. Question 19. A nurse is evaluating a patient's understanding of the dietary restrictions while on warfarin therapy after a pulmonary embolism. Which food choice made by the patient requires correction? A. Grilled chicken with steamed broccoli. B. Spinach salad with vinaigrette dressing. C. Baked salmon with quinoa. D. Greek yogurt with berries. Answer: B. Spinach salad with vinaigrette dressing. Rationale: spinach is high in vitamin K, which can interfere with the effectiveness of warfarin. Patients on warfarin should monitor their intake of vitamin K-rich foods and maintain consistent levels in their diet. Question 20. A patient with a confirmed pulmonary embolism develops sudden hypotension and cyanosis. What is the most likely cause, and what should the nurse do? A. Massive pulmonary embolism, initiate CPR. B. Hypovolemic shock, administer IV fluids rapidly. C. Cardiogenic shock, administer vasopressors. D. Anaphylactic reaction, administer epinephrine. Answer: A. Massive pulmonary embolism, initiate CPR. Rationale: sudden hypotension and cyanosis in a patient with a pulmonary embolism suggest a massive PE, which can lead to cardiovascular collapse. Immediate CPR is necessary to maintain circulation and oxygenation until more advanced interventions can be applied. Question 21. A patient is admitted with a suspected pulmonary embolism and is placed on continuous ECG monitoring. Which ECG finding is most commonly associated with a pulmonary embolism? A. Sinus bradycardia. B. Right bundle branch block. C. S1. Q3. T3. Pattern: prominent S wave in lead 1, Q wave in lead 3, and inverted T wave in lead 3. D. Atrial fibrillation. Answer: C. S1. Q3. T3. Pattern: prominent S wave in lead 1, Q wave in lead 3, and inverted T wave in lead 3. Rationale: the S1. Q3. T3. Pattern on an ECG is a classic, although not always present, finding in pulmonary embolism. It indicates acute right heart strain due to the increased pulmonary pressure from the embolism. Question 22. A patient recovering from surgery suddenly complains of shortness of breath and chest pain. The nurse suspects a pulmonary embolism. What diagnostic test is most likely to be ordered to confirm this diagnosis? A. Chest X-ray. B. Pulmonary angiography. C. Ventilation perfusion, VQ, scan. D. D-dimer test. Answer: B. Pulmonary angiography. Rationale: pulmonary angiography is considered the gold standard for diagnosing a pulmonary embolism, as it provides a direct visualization of the pulmonary vasculature. While VQ scans and D-dimer tests are also used, angiography is the definitive test. Question 23. A patient with a known pulmonary embolism is receiving oxygen therapy. Despite this, the patient's oxygen saturation remains low. What should the nurse consider as the next step? A. Increase the oxygen flow rate. B. Switch to a non-rebreather mask. C. Prepare for intubation and mechanical ventilation. D. Check the patient's blood pressure. Answer: C. Prepare for intubation and mechanical ventilation. Rationale: persistent hypoxemia despite oxygen therapy may indicate severe impairment of gas exchange due to the pulmonary embolism. Intubation and mechanical ventilation may be necessary to ensure adequate oxygenation. Question 24. A patient on long-term warfarin therapy for a previous pulmonary embolism presents with dark tarry stools. What is the nurse's most appropriate action? A. Advise the patient to increase dietary fiber. B. Check the patient's INR and contact the healthcare provider. C. Administer vitamin K as an antidote. D. Encourage the patient to drink more fluids. Answer: B. Check the patient's INR and contact the healthcare provider. Rationale: dark tarry stools indicate gastrointestinal bleeding, which can be a serious complication of warfarin therapy. The INR should be checked to assess the degree of anticoagulation, and the healthcare provider should be notified immediately. Question 25. A patient being treated for a pulmonary embolism with low molecular weight heparin, LMWH, complains of severe abdominal pain. The nurse assesses significant bruising around the injection sites. What should the nurse do next? A. Administer a higher dose of LMWH to manage the pain. B. Notify the healthcare provider and prepare to administer protamine sulfate. C. Apply ice to the bruised areas to reduce swelling. D. Instruct the patient to take an over-the-counter pain reliever. Answer B. Notify the healthcare provider and prepare to administer protamine sulfate. Rationale: severe abdominal pain and extensive bruising can indicate internal bleeding, a potential side effect of LMWH. Protamine sulfate may be administered as an antidote, but the healthcare provider must be notified first.
Hi, everyone. This is Nurse Anna from nursestudy.net, and today we are continuing our cardiac disorder series. This is Endocarditis, 25 questions with answers and rationales. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 45-year-old male with a history of intravenous drug use presents with fever, chills, and a new heart murmur. Blood cultures are positive for Staphylococcus aureus. Which of the following is the priority nursing intervention? A. Administer prescribed antibiotics after obtaining blood cultures. B. Prepare the patient for valve replacement surgery. C. Monitor the patient for signs of heart failure. D. Educate the patient about the importance of completing the antibiotic regimen. Answer A. Rationale: administering prescribed antibiotics after obtaining blood cultures is the priority intervention to treat the infection and prevent further complications. Valve replacement surgery and monitoring for heart failure may be necessary later, but initial treatment focuses on controlling the infection. Patient education is also crucial, but not the immediate priority. Question 2. A patient with endocarditis develops sudden, severe chest pain and shortness of breath. An ECG reveals ST segment elevation. What should the nurse suspect as the cause? A. Pulmonary embolism. B. Myocardial infarction. C. Pericarditis. D. Aortic dissection. Answer B. Rationale: myocardial infarction, MI, is the most likely cause of ST segment elevation in a patient with endocarditis. Embolic events can lead to coronary artery occlusion, resulting in an MI. While pulmonary embolism, pericarditis, and aortic dissection can cause chest pain, they are less likely to present with ST segment elevation on an ECG. Question 3. A 62-year-old patient with a history of prosthetic valve replacement presents with fever, fatigue, and weight loss. The patient is diagnosed with prosthetic valve endocarditis. Which of the following clinical findings should prompt the nurse to immediately contact the healthcare provider? A. New onset of confusion and altered mental status. B. Development of osseous nodes on the fingers and toes. C. Presence of splinter hemorrhages under the fingernails. D. A persistent low-grade fever. Answer A. Rationale: new onset of confusion and altered mental status in a patient with endocarditis may indicate an embolic stroke, which is a medical emergency requiring immediate attention. Osseous nodes, splinter hemorrhages, and a low-grade fever are common findings in endocarditis, but do not require urgent intervention. Question 4. A nurse is assessing a patient with suspected infective endocarditis. Which of the following findings would be most concerning and require immediate action? A. Janeway lesions on the palms and soles. B. Hematuria with flank pain. C. A new diastolic murmur. D. Petechiae on the upper chest and arms. Answer: C. Rationale: a new diastolic murmur in a patient with suspected infective endocarditis is concerning as it may indicate valve dysfunction, such as aortic regurgitation, which can lead to heart failure if not promptly managed. Janeway lesions, hematuria, and petechiae are associated with endocarditis, but do not require immediate intervention. Question 5. A 50-year-old male with a history of rheumatic heart disease is admitted with infective endocarditis. Which of the following symptoms should the nurse monitor for that could indicate a complication of the condition? A. Sudden, severe back pain. B. Bilateral lower extremity edema. C. Persistent, dry cough. D. Progressive dyspnea and orthopnea. Answer: A. Rationale: sudden, severe back pain could indicate an embolic event, such as a splenic or renal infarction, which is a serious complication of infective endocarditis. Bilateral lower extremity edema, a persistent dry cough, and progressive dyspnea may suggest heart failure but are less specific to embolic events. Question 6. During the care of a patient with infective endocarditis, the nurse notes that the patient has developed sudden, painless erythematous lesions on the palms and soles. What is the most appropriate nursing action? A. Document the findings and continue to monitor the patient. B. Notify the healthcare provider immediately. C. Apply topical corticosteroids to the lesions. D. Educate the patient about the importance of hygiene. Answer: B. Rationale: sudden, painless erythematous lesions on the palms and soles are known as Janeway lesions, which are associated with infective endocarditis and can indicate systemic emboli. These findings should be reported immediately to the healthcare provider, as they may necessitate changes in the treatment plan. Documentation is important, but notifying the healthcare provider takes precedence. Applying topical corticosteroids and hygiene education are not relevant in this context. Question 7. A nurse is caring for a patient with suspected infective endocarditis who is experiencing persistent fever and night sweats. Blood cultures have been obtained, and the healthcare provider has prescribed antibiotics. Which nursing action is the priority? A. Administer antipyretics as needed for fever management. B. Administer the prescribed antibiotics as soon as possible. C. Ensure the patient maintains adequate hydration. D. Monitor for signs of septic shock. Answer: B. Rationale: the priority nursing action is to administer the prescribed antibiotics as soon as possible to treat the infection and prevent further complications. While managing fever, maintaining hydration, and monitoring for septic shock are important, initiating antibiotic therapy is crucial to addressing the underlying infection. Question 8. A patient with a history of infective endocarditis is being discharged. The nurse is providing education on signs and symptoms that require immediate medical attention. Which of the following should the nurse emphasize? A. Fatigue and mild joint pain. B. Persistent low-grade fever and weight loss. C. New onset of chest pain and shortness of breath. D. Mild nausea and loss of appetite. Answer: C. Rationale: new onset of chest pain and shortness of breath in a patient with a history of infective endocarditis may indicate a serious complication such as a myocardial infarction or pulmonary embolism, both of which require immediate medical attention. Fatigue, joint pain, mild fever, weight loss, nausea, and loss of appetite may occur with chronic conditions but are less urgent. Question 9. A 70-year-old patient with a prosthetic valve is admitted with suspected endocarditis. The patient is experiencing chills, fever, and malaise. Blood cultures are pending. What should the nurse prioritize in the initial care plan? A. Initiate contact precautions to prevent infection spread. B. Begin empiric antibiotic therapy as ordered by the healthcare provider. C. Prepare the patient for immediate valve replacement surgery. D. Educate the patient on the importance of hand hygiene. Answer: B. Rationale: the priority is to begin empiric antibiotic therapy as ordered to treat the suspected infection, even while awaiting blood culture results. This is critical in managing endocarditis. Contact precautions are not typically required unless there is a concern for a specific transmissible infection. Valve replacement surgery might be necessary later, but is not the immediate priority. Hand hygiene education, while important, is not the initial focus. Question 10. A nurse is evaluating a patient with infective endocarditis who suddenly develops hemiparesis and aphasia. What is the most likely cause of these symptoms? A. Embolic stroke. B. Subdural hematoma. C. Brain abscess. D. Acute encephalitis. Answer: A. Rationale: hemiparesis and aphasia in a patient with infective endocarditis are most likely due to an embolic stroke. Vegetations from the infected heart valve can embolize to the brain, leading to a stroke. Subdural hematoma, brain abscess, and acute encephalitis can also cause neurological symptoms but are less likely in this context. Question 11. A patient with endocarditis is receiving long-term intravenous antibiotic therapy. Which complication should the nurse monitor for that may indicate worsening of the condition? A. Recurrent fever and night sweats. B. Sudden onset of severe lower back pain. C. Development of a new systolic murmur. D. Persistent anorexia and weight loss. Answer: C. Rationale: the development of a new systolic murmur may indicate worsening valvular damage, which is a serious complication of endocarditis. Recurrent fever, night sweats, back pain, anorexia, and weight loss are concerning but do not specifically indicate worsening of the condition as clearly as a new murmur. Question 12. A nurse is caring for a patient with suspected infective endocarditis. Which of the following diagnostic tests is most crucial for confirming the diagnosis? A. Chest X-ray. B. Electrocardiogram (ECG). C. Transthoracic echocardiogram (TTE). D. Complete blood count (CBC). Answer: C. Rationale: a transthoracic echocardiogram (TTE) is crucial for confirming the diagnosis of infective endocarditis as it allows visualization of vegetations on the heart valves. Chest X-ray (ECG) and CBC provide supportive information but are not definitive for diagnosing endocarditis. Question 13. A patient with infective endocarditis reports sudden loss of vision in the left eye. What should the nurse suspect? A. Retinal detachment. B. Embolic event. C. Optic neuritis. D. Glaucoma attack. Answer: B. Rationale: sudden loss of vision in a patient with infective endocarditis suggests an embolic event affecting the retinal artery. This is an emergency and requires immediate medical intervention. Retinal detachment, optic neuritis, and glaucoma attacks are less likely in the context of endocarditis. Question 14. A nurse is caring for a patient with infective endocarditis who develops a new-onset heart murmur and a petechial rash. What should the nurse anticipate as the next step in management? A. Increase the dose of antibiotics. B. Schedule an urgent echocardiogram. C. Administer corticosteroids to reduce inflammation. D. Prepare for immediate surgical intervention. Answer: B. Rationale: a new-onset heart murmur and a petechial rash in a patient with infective endocarditis warrant an urgent echocardiogram to assess for valvular damage and vegetations. Increasing the antibiotic dose, administering corticosteroids, or preparing for surgery may be considered later based on echocardiogram findings. Question 15. A patient with a history of endocarditis presents with a fever, malaise, and a new heart murmur. Blood cultures have been drawn. What is the most appropriate initial nursing action? A. Administer broad-spectrum antibiotics as prescribed. B. Obtain a detailed history of recent dental or surgical procedures. C. Prepare the patient for an echocardiogram. D. Educate the patient on the importance of completing the full course of antibiotics. Answer: A. Rationale: the most appropriate initial action is to administer broad-spectrum antibiotics as prescribed to begin treating the suspected infection. A detailed history, echocardiogram, and patient education are important but can be done after starting antibiotic therapy to address the immediate risk of infection progression. Question 16. A patient with a history of intravenous drug use is admitted with infective endocarditis. The nurse observes that the patient has developed new-onset hematuria and flank pain. What is the most likely cause of these symptoms? A. Renal calculi. B. Acute kidney injury. C. Embolic infarction of the kidney. D. Urinary tract infection. Answer: C. Rationale: new-onset hematuria and flank pain in a patient with infective endocarditis suggest an embolic infarction of the kidney, a serious complication where emboli from infected heart valves lodge in the renal arteries, causing tissue ischemia. Renal calculi, acute kidney injury, and urinary tract infection are possible causes, but are less likely in the context of endocarditis. Question 17. A nurse is caring for a patient with infective endocarditis who suddenly develops hemoptysis and pleuritic chest pain. Which complication should the nurse suspect? A. Pulmonary embolism. B. Pneumonia. C. Pulmonary abscess. D. Heart failure. Answer: A. Rationale: hemoptysis and pleuritic chest pain in a patient with infective endocarditis are concerning for a pulmonary embolism, likely due to septic emboli traveling to the lungs. Pneumonia and pulmonary abscesses could present with similar symptoms but are less immediately likely in this scenario. Heart failure typically presents with dyspnea and edema rather than hemoptysis. Question 18. A patient with suspected endocarditis reports worsening dyspnea and is found to have crackles on lung auscultation. What is the nurse's priority intervention? A. Administer diuretics as prescribed. B. Elevate the head of the bed. C. Initiate oxygen therapy. D. Notify the healthcare provider immediately. Answer: D. Rationale: worsening dyspnea and crackles in a patient with endocarditis may indicate heart failure or pulmonary edema. Immediate notification of the healthcare provider is crucial to assess the need for further intervention. While oxygen therapy and diuretics may be necessary, the priority is to inform the healthcare provider to guide comprehensive management. Question 19. A patient with infective endocarditis has been receiving IV antibiotics for 2 weeks. The nurse notes that the patient has developed a painful, red, and swollen joint in the right knee. What should the nurse suspect as the cause? A. Septic arthritis. B. Deep vein thrombosis, DVT. C. Gout. D. Rheumatoid arthritis flare-up. Answer: A. Rationale: painful, red, and swollen joints in a patient with infective endocarditis may indicate septic arthritis, a condition where infection spreads to the joint space. DVT, gout, and rheumatoid arthritis could cause similar symptoms, but in the context of endocarditis, septic arthritis is most concerning and requires immediate evaluation and treatment. Question 20. A nurse is reviewing the echocardiogram results of a patient with infective endocarditis. The report indicates the presence of vegetations on the mitral valve. What is the primary concern associated with this finding? A. Increased risk of systemic emboli. B. Development of aortic stenosis. C. Formation of pericardial effusion. D. Onset of atrial fibrillation. Answer A. Rationale: vegetations on the mitral valve and infective endocarditis significantly increase the risk of systemic emboli, where pieces of the vegetations can break off and travel to other parts of the body, leading to complications such as stroke or organ infarction. Aortic stenosis, pericardial effusion, and atrial fibrillation are not directly associated with mitral valve vegetations in endocarditis. Question 21. A patient with a history of endocarditis presents with sudden severe abdominal pain and a drop in blood pressure. What is the most appropriate nursing action? A. Administer IV fluids and monitor vital signs closely. B. Prepare the patient for emergency surgery. C. Administer prescribed analgesics for pain relief. D. Position the patient in Trendelenburg position. Answer B. Rationale: sudden severe abdominal pain and hypotension in a patient with a history of endocarditis suggest a potential embolic event leading to a mesenteric infarction or ruptured aneurysm, both of which are surgical emergencies. The priority is to prepare the patient for emergency surgery. While IV fluids and analgesics are important, they are secondary to surgical intervention in this case. The Trendelenburg position is not indicated. Question 22. A nurse is providing discharge education to a patient with a recent diagnosis of infective endocarditis. Which of the following instructions is most important to include? A. Avoid all physical activity until cleared by the healthcare provider. B. Report any signs of infection, such as fever or chills, immediately. C. Continue antibiotic therapy until the symptoms completely resolve. D. Limit fluid intake to reduce the risk of heart failure. Answer B. Rationale: it is crucial for the patient to report any signs of infection, such as fever or chills, immediately, as these could indicate a recurrence or complication of endocarditis. While physical activity may need to be modified, complete avoidance is not necessary unless advised. Antibiotic therapy should be completed as prescribed, not just until symptoms resolve. Fluid restriction is not universally recommended and should be individualized. Question 23. A nurse is assessing a patient with endocarditis who is receiving long-term antibiotic therapy. The patient complains of new-onset hearing loss. What is the most likely cause of this symptom? A. Ototoxicity from antibiotic therapy. B. Embolic event affecting the auditory cortex. C. Meniere's disease. D. Cerumen impaction. Answer A. Rationale: ototoxicity, particularly from certain antibiotics like aminoglycosides, can cause hearing loss and is a known complication of long-term antibiotic therapy. While embolic events can cause neurological deficits, they are less likely to specifically affect hearing. Meniere's disease and cerumen impaction are other possible causes, but are less relevant in the context of endocarditis treatment. Question 24. A patient with a mechanical heart valve presents with symptoms of endocarditis. The nurse knows that which of the following diagnostic tests is most essential for detecting complications related to the mechanical valve. A. Transesophageal echocardiogram, TEE. B. Magnetic resonance imaging, MRI. C. Computed tomography, CT, scan of the chest. D. Blood cultures. Answer A. Rationale: a transesophageal echocardiogram TE is essential for detecting complications related to a mechanical heart valve in the context of endocarditis, as it provides detailed images of the heart valves and surrounding structures. While MRI and CT scans can be useful for other diagnostic purposes, and blood cultures are critical for identifying the causative organism, TE is the most specific for evaluating mechanical valve function. Question 25. A nurse is managing the care of a patient with infective endocarditis who is experiencing increasing shortness of breath and fatigue. Which of the following diagnostic findings would indicate the development of heart failure? A. Elevated brain natriuretic peptide (BNP) levels. B. Decreased hemoglobin and hematocrit. C. Increased white blood cell count. D. Prolonged QT interval on ECG. Answer A. Rationale: elevated brain natriuretic peptide (BNP) levels are a marker of heart failure and indicate that the patient's heart is under stress due to the inability to pump effectively, which can occur as a complication of endocarditis. Decreased hemoglobin, increased white blood cell count, and a prolonged QT interval do not directly indicate heart failure.
Hi, everyone. This is Nurse Anna from nursestudy.net, and we're continuing, of course, our cardiovascular disorders. This is hypertension. This is 25 questions with answers and rationales. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 55-year-old male with a history of hypertension presents to the emergency department with severe headache, blurred vision, and confusion. His blood pressure is 210 over 120 millimeters of mercury. The nurse anticipates which of the following interventions? A. Administration of intravenous hydralazine. B. Administration of oral furosemide. C. Administration of sublingual nitroglycerin. D. Administration of oral enalapril. Answer A. Administration of intravenous hydralazine. Rationale: the patient is experiencing a hypertensive crisis, and rapid reduction of blood pressure is critical to prevent organ damage. Intravenous hydralazine is a direct-acting vasodilator that can quickly reduce blood pressure, making it the preferred choice in this emergency situation. Question 2. A 60-year-old female with poorly controlled hypertension and a history of chronic kidney disease is prescribed lisinopril. The nurse knows that which of the following laboratory values should be closely monitored? A. Serum sodium. B. Serum potassium. C. Serum calcium. D. Serum magnesium. Answer B. Serum potassium. Rationale: lisinopril is an ACE inhibitor, which can increase potassium levels by inhibiting the renin-angiotensin-aldosterone system. Hyperkalemia is a significant risk, especially in patients with chronic kidney disease, necessitating close monitoring of serum potassium levels. Question 3. A 48-year-old male with hypertension and type 2 diabetes mellitus is being discharged with a prescription for an angiotensin II receptor blocker, ARB. The nurse should include which of the following points in the patient education? A. This medication may cause a persistent dry cough. B. Report any signs of facial swelling or difficulty breathing immediately. C. You will need regular blood tests to monitor your thyroid function. D. Avoid foods high in vitamin K while taking this medication. Answer B. Report any signs of facial swelling or difficulty breathing immediately. Rationale: ARBs can cause angioedema, a potentially life-threatening condition characterized by swelling of the face, lips, and airway. The nurse must emphasize the importance of reporting these symptoms immediately. Question 4. A patient with hypertension is prescribed spironolactone. Which of the following is the most important nursing consideration? A. Monitoring for signs of hypercalcemia. B. Monitoring for signs of hypokalemia. C. Monitoring for signs of hyperkalemia. D. Monitoring for signs of hyponatremia. Answer C. Monitoring for signs of hyperkalemia. Rationale: spironolactone is a potassium-sparing diuretic, which can lead to hyperkalemia. Nurses should monitor the patient's potassium levels and assess for symptoms such as muscle weakness, fatigue, and arrhythmias. Question 5. A 65-year-old patient with hypertension and a history of myocardial infarction is prescribed a beta blocker. Which of the following is a key point the nurse should include in the patient's education? A. You may experience weight gain while taking this medication. B. This medication may cause your blood sugar to drop. C. Do not stop taking this medication abruptly. D. You should avoid consuming dairy products with this medication. Answer: C. Do not stop taking this medication abruptly. Rationale: abrupt discontinuation of beta blockers can lead to rebound hypertension and increase the risk of a myocardial infarction. Patients must be instructed to taper off the medication under medical supervision if discontinuation is necessary. Question 6. A patient with long-standing hypertension presents with complaints of muscle cramps and palpitations. Laboratory tests reveal hypokalemia. The nurse knows that which of the following antihypertensive medications is most likely responsible? A. Lisinopril. B. Amlodipine. C. Hydrochlorothiazide. D. Losartan. Answer: C. Hydrochlorothiazide. Rationale: hydrochlorothiazide is a thiazide diuretic, which can cause potassium loss, leading to hypokalemia. Patients on this medication should have their potassium levels monitored regularly, and they may require potassium supplementation. Question 7. A 72-year-old female with hypertension and chronic obstructive pulmonary disease, COPD, is prescribed a calcium channel blocker. Which of the following potential side effects should the nurse monitor for? A. Reflex tachycardia. B. Bradycardia. C. Dry cough. D. Hyperkalemia. Answer: B. Bradycardia. Rationale: calcium channel blockers, particularly non-dihydropyridines like verapamil and diltiazem, can cause bradycardia by slowing down the conduction through the AV node. This is particularly important to monitor in patients with existing heart conditions. Question 8. A patient with hypertension is prescribed a medication that works by reducing sympathetic nervous system activity. The nurse knows this medication is likely: A. A beta blocker. B. An alpha-1 blocker. C. A central alpha-2 agonist. D. An angiotensin-converting enzyme (ACE) inhibitor. Answer: C. A central alpha-2 agonist. Rationale: central alpha-2 agonists, such as clonidine, reduce sympathetic nervous system activity by stimulating alpha-2 adrenergic receptors in the brain, leading to decreased peripheral vascular resistance and lowering blood pressure. Question 9. A patient with a history of hypertension is admitted with a suspected stroke. Which of the following medications would the nurse anticipate being withheld initially? A. Labetalol. B. Clonidine. C. Amlodipine. D. Enalapril. Answer: D. Enalapril. Rationale: in the setting of an acute stroke, the management of blood pressure is crucial. ACE inhibitors like enalapril are generally withheld in the acute phase to avoid excessive lowering of blood pressure, which can compromise cerebral perfusion. Question 10. A patient with hypertension and heart failure is prescribed a combination of hydralazine and isosorbide dinitrate. The nurse should monitor the patient for which of the following adverse effects? A. Hyperglycemia. B. Tachycardia. C. Hyponatremia. D. Hyperkalemia. Answer: B. Tachycardia. Rationale: hydralazine can cause reflex tachycardia due to its vasodilatory effects, which can stimulate the sympathetic nervous system. This combination therapy is particularly beneficial in certain populations, such as African American patients with heart failure, but requires close monitoring for this side effect. Question 11. A 70-year-old male with a history of hypertension and chronic renal failure is prescribed an ACE inhibitor. The nurse understands that the patient's renal function should be monitored closely because A. ACE inhibitors increase glomerular filtration rate, GFR. B. ACE inhibitors decrease the risk of hyperkalemia. C. ACE inhibitors can lead to acute kidney injury. D. ACE inhibitors reduce proteinuria. Answer: C. ACE inhibitors can lead to acute kidney injury. Rationale: ACE inhibitors can cause a reduction in renal perfusion, particularly in patients with already compromised kidney function, potentially leading to acute kidney injury. Monitoring renal function is essential to prevent further renal damage. Question 12. A patient with newly diagnosed hypertension is prescribed hydrochlorothiazide. The nurse should educate the patient to report which of the following symptoms as a possible adverse effect. A. Persistent dry cough. B. Muscle cramps. C. Weight gain. D. Constipation. Answer: B. Muscle cramps. Rationale: hydrochlorothiazide can cause electrolyte imbalances, including hypokalemia, which can lead to muscle cramps. Patients should be advised to report these symptoms, as they may require potassium supplementation or adjustment of the medication. Question 13. A patient with hypertension is being treated with a combination of an ACE inhibitor and a thiazide diuretic. The nurse knows that this combination therapy is effective because A. The diuretic minimizes the cough associated with the ACE inhibitor. B. The ACE inhibitor prevents hypokalemia caused by the diuretic. C. The combination reduces the risk of hyperglycemia. D. The combination therapy decreases the risk of angioedema. Answer: B. The ACE inhibitor prevents hypokalemia caused by the diuretic. Rationale: thiazide diuretics can cause hypokalemia, while ACE inhibitors can increase potassium levels. The combination helps balance these effects, making it an effective and safe therapy for hypertension. Question 14. A patient with hypertension and a history of stroke is prescribed an ARB. Which laboratory value is most important for the nurse to monitor? A. Serum calcium. B. Serum potassium. C. Serum sodium. D. Serum chloride. Answer: B. Serum potassium. Rationale: ARBs can cause hyperkalemia by inhibiting the effects of angiotensin II on the adrenal glands, reducing aldosterone secretion. Monitoring potassium levels is crucial, especially in patients with comorbid conditions that predispose them to hyperkalemia. Question 15. A patient with hypertension and chronic heart failure is prescribed a beta blocker. The nurse should assess for which of the following before administering the medication. A. Blood glucose levels. B. Heart rate. C. Serum calcium. D. Respiratory rate. Answer: B. Heart rate. Rationale: beta blockers slow down the heart rate by blocking the effects of adrenaline on the heart. If the patient has a low heart rate, bradycardia, administering the medication could lead to symptomatic bradycardia or heart block, so assessing heart rate is essential before administration. Question 16. A patient with hypertension is prescribed amlodipine. The nurse knows that which of the following is a common side effect of this medication. A. Peripheral edema. B. Hyperkalemia. C. Bradycardia. D. Hypoglycemia. Answer: A. Peripheral edema. Rationale: amlodipine, a calcium channel blocker, can cause peripheral edema due to its vasodilatory effects, particularly in the lower extremities. Patients should be monitored for swelling and other signs of fluid retention. Question 17. A patient with hypertension is started on an alpha-1 blocker. The nurse should educate the patient to avoid which of the following? A. Taking the medication with food. B. Standing up quickly from a sitting position. C. Using salt substitutes. D. Drinking grapefruit juice. Answer, B. Standing up quickly from a sitting position. Rationale: alpha-1 blockers can cause orthostatic hypotension, leading to dizziness or fainting when standing up quickly. Patients should be instructed to rise slowly from sitting or lying positions to prevent falls. Question 18. A patient with hypertension and hyperlipidemia is prescribed a statin along with an ACE inhibitor. The nurse should monitor the patient for which of the following adverse effects? A. Myalgia. B. Dry cough. C. Hyperkalemia. D. Hyperglycemia. Answer, A. Myalgia. Rationale: statins can cause muscle-related side effects, such as myalgia, which can sometimes progress to more serious conditions like rhabdomyolysis. Patients should report any unexplained muscle pain or weakness to their healthcare provider. Question 19. A 58-year-old male with hypertension is prescribed a medication that inhibits the conversion of angiotensin I to angiotensin II. Which of the following side effects should the nurse educate the patient to report immediately? A. Persistent dry cough. B. Flushing. C. Tinnitus. D. Photosensitivity. Answer, A. Persistent dry cough. Rationale: ACE inhibitors, which inhibit the conversion of angiotensin I to angiotensin II, can cause a persistent dry cough due to the accumulation of bradykinin. This side effect is common and may require discontinuation of the medication if it becomes intolerable. Question 20. A patient with uncontrolled hypertension is at risk for developing hypertensive encephalopathy. The nurse should monitor the patient for which of the following signs and symptoms? A. Polyuria and polydipsia. B. Severe headache and vomiting. C. Nausea and diarrhea. D. Chest pain and palpitations. Answer, B. Severe headache and vomiting. Rationale: hypertensive encephalopathy is a medical emergency characterized by a sudden, severe increase in blood pressure leading to cerebral edema. Symptoms include severe headache, vomiting, confusion, and in some cases, seizures. Immediate intervention is required. Question 21. A 65-year-old female with hypertension and a history of atrial fibrillation is prescribed a beta blocker. The nurse knows that the effectiveness of the medication should be evaluated based on A. Blood pressure and heart rate. B. Blood glucose and serum potassium levels. C. Respiratory rate and oxygen saturation. D. Serum creatinine and GFR. Answer, A. Blood pressure and heart rate. Rationale: beta blockers are used to manage both hypertension and atrial fibrillation by lowering blood pressure and controlling heart rate. Monitoring these parameters is essential to evaluate the effectiveness of the therapy. Question 22. A patient with hypertension is prescribed a diuretic and a beta blocker. The nurse should monitor for which potential interaction between these two medications? A. Hypercalcemia. B. Hyperkalemia. C. Bradycardia. D. Hypoglycemia. Answer, C. Bradycardia. Rationale: beta blockers can lower heart rate, and when combined with diuretics, especially those that may cause electrolyte imbalances, the risk of bradycardia can be increased. Monitoring heart rate is important when these medications are used together. Question 23. A patient with hypertension is experiencing a hypertensive emergency. The nurse anticipates administering which of the following medications to rapidly lower blood pressure? A. Intravenous nitroprusside. B. Oral losartan. C. Sublingual nifedipine. D. Oral atenolol. Answer: A. Intravenous nitroprusside. Rationale: intravenous nitroprusside is a potent vasodilator that can rapidly lower blood pressure in a hypertensive emergency. It is administered in a controlled environment to prevent excessive hypotension and ensure patient safety. Question 24. A patient with hypertension is being treated with a combination of an ACE inhibitor and a loop diuretic. The nurse knows that this combination therapy is used primarily for which purpose? A. To increase urine output. B. To minimize the risk of hypokalemia. C. To reduce the risk of hypercalcemia. D. To enhance blood pressure control. Answer: D. To enhance blood pressure control. Rationale: the combination of an ACE inhibitor and a loop diuretic is effective in controlling blood pressure, particularly in patients with resistant hypertension. The diuretic reduces fluid volume, while the ACE inhibitor relaxes blood vessels, providing a synergistic effect. Question 25. A 72-year-old male with hypertension and benign prostatic hyperplasia, BPH, is prescribed an alpha-1 blocker. The nurse should be particularly vigilant for which of the following adverse effects? A. Hypotension. B. Bradycardia. C. Hyperkalemia. D. Hyperglycemia. Answer: A. Hypotension. Rationale: alpha-1 blockers can cause significant hypotension, especially after the first dose, due to their vasodilatory effects. This risk is heightened in elderly patients, necessitating close monitoring of blood pressure, particularly when the medication is first initiated.